I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. Is your attic, basement, or garage filled to the brim with stuff? What's the difference between collecting and hoarding? This is the People's Pharmacy with Terry and Joe Graydon.
When hoarding behavior gets out of control, it's considered a disorder. How would you know if you or a family member has gone over the line?
As someone who accumulates medical research articles in piles around my desk, I can relate to people who have difficulty discarding stuff. How can we get started reorganizing our stacks of paper?
Joe, once you get organized, how will you keep the clutter from accumulating again?
Coming up on the People's Pharmacy, everything you ever needed to know about hoarding.
In the People's Pharmacy Health Headlines, masks are important to limit the spread of the Omicron variant of SARS-CoV-2. This form of the coronavirus spreads far more easily and quickly than previous versions. That's why switching to a really effective mask and wearing it properly and consistently makes sense. When the pandemic began, there were not enough high-quality N95 masks for everyone. So the CDC encouraged ordinary citizens to use cloth masks and save the most effective equipment for healthcare providers. At this point, though, there's no longer a shortage. Expert consensus is growing that all of us should be wearing a KN95 or an N95 mask whenever we're indoors with people outside our household. N95s are approved by the National Institute for Occupational Safety and Health. The 95 indicates that they filter out 95% of the particles that could make us sick. The CDC has a list of approved N95 respirators on its website.
People with diabetes are at higher risk for complications from COVID-19. Now, the CDC reports that the virus puts children at greater risk for developing diabetes. The researchers used two large insurance databases to compare the health of youngsters who had contracted COVID to those who had avoided the infection. In one of the databases, more than 80,000 kids were diagnosed with COVID-19 between March 2020 and February 2021. The other database involved nearly 440,000 youngsters diagnosed between March 2020 and June 2021. In both datasets, children recovering from infection were significantly more likely to develop diabetes. Scientists were not able to determine whether type 1 or type 2 diabetes accounted for most of the cases. They also don't know if the metabolic disorder is temporary or permanent.
An international team of researchers has discovered that the common germ-fighting compound, triclosan, can disrupt the gut microbiome. Triclosan is found in some hand sanitizers, shampoo, shaving gels, and toothpaste, as well as a range of other products. The scientists found that interactions between the compound and certain gut bacteria producing specific enzymes can trigger damage to the lining of the colon. They were able to prevent the colitis by keeping the bacteria from processing triclosan. Since the compound is absorbed from the gastrointestinal tract, some experts have called for it to be removed from products that might be swallowed. Since triclosan can disrupt the gut microbiome, consumers might be prudent to avoid it whenever possible.
Adding a bit of olive oil to your daily salad could help you live a longer, healthier life. That's the inference from data published in the Journal of the American College of Cardiology. Harvard scientists tracked more than 60,000 women in the Nurses' Health Study and more than 30,000 men in the Health Professionals' Follow-Up Study. The volunteers filled out detailed dietary questionnaires every few years for nearly 3 decades. During the study, 36,850 of the participants died. In analyzing the data, the researchers determined that those who consumed at least half a tablespoon of olive oil a day were 19% less likely to die from cardiovascular causes, 17% less likely to die of cancer, and 19% less likely to die for any reason. The investigators calculate that substituting olive oil for mayonnaise, margarine, butter, or other dairy fat would significantly lower mortality.
This isn't the first time that olive oil has been demonstrated to have health benefits. An accompanying editorial reminds cardiologists that olive oil is the cornerstone in the Mediterranean diet. This eating pattern, with its emphasis on vegetables, fruits, legumes, fish, and whole grains, has been associated with a lower risk of heart disease and cancer. The PREDIMED study randomized more than 7,000 Spanish adults at high risk for heart disease. One group consumed a Mediterranean diet enriched with 4 tablespoons a day of extra virgin olive oil. Another group followed a similar diet but added an ounce of nuts a day instead of olive oil. The control group was supposed to follow a low-fat diet. Those consuming olive oil or nuts were significantly less likely to have cardiovascular problems or die during the study. And that's the health news from the People's Pharmacy this week.
Welcome to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. Do you have a closet or a drawer that's overflowing with stuff? Most of us do, but some people have every closet and every drawer full to bursting. There may even be piles of paper on every conceivable surface. Basements and garages might be filled to the brim. Is this just normal clutter, or could it be hoarding?
To learn more about hoarding, we have 2 guests today. Later, we will talk with Dr. Christiana Bradiotis, Associate Professor in the School of Social Work at the University of British Columbia. She is co-author of the book Hoarding, What Everyone Needs to Know. First, though, we turn to her co-author, Dr. Gail Steketee. She is Dean Emerita and Professor Emerita at the Boston University School of Social Work. Her research is focused on the nature of hoarding symptoms, including difficulty discarding, clutter, and excessive acquiring. She's developed and tested cognitive and behavioral treatments for OCD and hoarding.
Welcome to the People's Pharmacy, Dr. Gail Steketee.
Glad to be here.
Dr. Steketee, a lot of people may think of hoarding in terms of, the tabloid newspaper reports or something on TV where, somebody gets buried under a pile of junk and dies. But it's actually a mental illness. How do you define hoarding disorder?
Hoarding disorder is defined in the Diagnostic and Statistical Manual for Mental Disorders as people who have a problem with excessive saving of objects, attachment to those objects, and inability or difficulty letting go of them, discarding them or giving them away or recycling them. And the critical part of this is that those behaviors have to create a significant problem in their everyday lives and interfere with the use of the living spaces in their home.
So, for example, a person whose coffee table and dining room table and other horizontal surfaces have become so piled up with papers that they are embarrassed to have company over, would that qualify?
It might qualify. It depends on the rest of the spaces. So if they can't eat food at the dining room table or the kitchen table anymore, or both tables is more to the point, if they can't use the surfaces in the living spaces, in the bedrooms, etc., then that begins to raise a question about whether or not hoarding disorder would apply.
How common is it?
Pretty common, unusually common. So it's probably around 2% of the population. So that's 2 in every 100 people or so. That also means that most of us know somebody who has a hoarding problem, although they might not have divulged the information to us.
Now, Dr. Steketee, when the pandemic first hit, a lot of people stocked up on toilet paper, hand sanitizer, all kinds of supplies that they normally wouldn't have lots and lots of. And I suspect that most of them don't still have big piles of toilet paper squirreled away in closets, but some people may. What's the difference between hoarding and hoarding disorder?
Well, hoarding behavior at a milder level is typical of what we saw during the pandemic or the early phases of the pandemic, where people didn't understand how much toilet paper they might need because nobody knew how long this was going to go on. But at the same time, because we were all very anxious, we overestimated what we thought we needed. And we knew we were stuck at home. We weren't going to go to work, so we couldn't use bathrooms elsewhere. So that's all kind of normative anxiety behavior about needing resources when we're not sure how long we have to live without the access to them. But hoarding disorder is a much more chronic, persistent inability to use the spaces in your home because you can't let go of all of the objects you've collected.
Now, collecting things or having trouble discarding things, it's not that unusual. What symptoms would suggest that it's a disorder rather than just a habit?
Yeah. Well, there's a big difference between collecting and hoarding, although I use that term collecting because accumulating is perhaps the right term for someone with hoarding disorder. But people who collect things, so for example, I collect ladies' fans, and there I don't want more than one of the same kind or color of fan. I want multiple variations on it across the decades in which fans were used. And so a person who collects wants to display what they have, wants other people to see what they have, and often develop social relationships with other collectors who collect similar items. So that's a very different, very social and often historical or at least multi-determined type of object groupings. And they're often very organized, which is not typical of someone with a hoarding disorder.
Now, I have to admit that my desk quite frequently ends up with a lot of stuff on it. Paper and computer stuff and all kinds of junk. And, before I can invite somebody into my office, I do have to clean it up. Now, it's not as bad as the photo on the cover of your book, but it's certainly not squeaky clean either. I do like to hang on to, cool research articles, and that's why they end up in piles. Am I a hoarder?
Probably not, because you can clean it up quickly in order to let people come in without feeling too embarrassed about it. That kind of saving objects and piling them around is typical. Some of us are a bit messier and less organized than others, but it doesn't impair our ability to get our work done. We haven't lost the critical items in the piles. We don't have huge piles. We have small piles. And we can sort those out fairly quickly and put things back to whatever we think of as normal with reasonable speed.
Can you give us an example of perhaps a client or a patient of yours who reached the point where it was no longer just a little embarrassing or a little difficult to clean up, and how you dealt with that?
Well, I'll use one of the cases that we used in one of our books. And there, she, over time, and this is very typical, gradually, when the children were young and as they got older, accumulated many, many newspapers, magazines, and reading materials that she was very interested in. That's typical of many people with hoarding and hoarding disorder. They're information junkies, if you will. But she also, over time, saved all of her small children's, gradually getting older children's things, everything they produced at school, and I mean everything. So nothing got let go of, nothing was removed that might have represented her children's lives. And so over time, what happens is that those things accumulate along with many other things about which she's quite disorganized. So her kitchen table was full of, egg crates and pieces of paper, the milk carton that had been used but not thrown away yet, dishes that had been left out, and innumerable other objects around the house, so that you end up with large piles. And then what you have to do with that is work with people to decide where in the home they want to begin their efforts, and then what are the easiest areas to help them move forward with letting go of a few things as they practice some of the skills.
Do we have any idea what causes a hoarding disorder? Are there specific triggers?
There are potential triggers, but one of the strongest contributing factors looks like it's probably genetic and or family learning based. So I would say we're pretty close to most people with hoarding disorder have a first-degree relative who has this problem, a sibling, a brother, sister, or a parent or a grandparent. So it clearly runs in families, and it's possible that part of that is learned behavior. They see people who are older than them doing the same thing of collecting things and not letting go and being very attached to objects. The other possibility is that most people who hoard have an experience in their past of something that was unsettling, not the kind of thing that causes post-traumatic stress disorder, as we see in some people, but rather a minor trauma or a continuing trauma, like moving very frequently when they were young and having things disappear from their lives that they were very attached to when they were quite small. Losing a parent and having a deluge of objects that you inherit, and then you have to figure out what to do with. And your grief about the loss makes it harder to let go of those things. And for some people, that's really an acute and chronic and enduring issue. Whereas for others, it's temporary, and then after a year, they're able to deal with it. There are multiple causes of this problem, and it's going to be difficult for us to ever put our finger on a single cause.
You're listening to Dr. Gail Steketee. She's Dean Emerita and Professor Emerita at the Boston University School of Social Work. Her work is focused on the nature of hoarding symptoms, including difficulty discarding, clutter, and excessive acquiring. She's developed and tested cognitive and behavioral treatments for hoarding. She's the author of several books, including Hoarding, What Everyone Needs to Know.
After the break, how do partners deal with people who start to accumulate so much stuff?
Are there any items people don't hoard?
What kinds of treatments are available for people with hoarding disorder?
Dr. Steketee will tell us how she's helped people with difficult hoarding situations.
What should someone do if they suspect a family member might have a hoarding problem?
You're listening to The People's Pharmacy with Joe and Terry Graydon.
This podcast is made possible in part by CocoVia, maker of high-potency cocoflavanol supplements. Cocoflavanols are among the most well-studied plant-based nutrients, backed by 20 years of scientific research.
CocoVia Cardio Health is available in capsules or powder, providing 500 milligrams of cocoflavanols daily. This supports better blood flow and vascular performance.
CocoVia also offers Memory Plus, supplements with 750 milligrams of cocoflavanols. This product is backed by 4 different clinical studies demonstrating significant improvement in several aspects of memory.
CocoVia flavanols are derived from real cocoa beans. They offer you all the benefits of chocolate without the sugar. More information at cocovia.com. Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon.
The People's Pharmacy is brought to you in part by Kaya Biotics, organic probiotic products developed in Germany and made in the USA. KAYABiotics.com.
Also by CocoVia, offering its cardio health product with 500 milligrams of cocoflavanols in powder and capsule form. More information at cocovia.com.
Do you ever feel overwhelmed by the clutter in the garage or the attic? Starting to organize and separate the junk from the treasures can be daunting.
We're talking about hoarding with Dr. Gail Steketee, Dean Emerita and Professor Emerita at the Boston University School of Social Work. She is the author of several books, including her most recent, Hoarding, What Everyone Needs to Know.
Dr. Steketee, how do partners deal with people who start to accumulate all this stuff? It must be very challenging.
It's very challenging, I agree. Frustrating for someone who doesn't have hoarding tendencies to understand why someone would keep things that don't make any sense to them. And the kinds of things that might be kept, for example, could be old receipts that were from 20 years ago that are no longer relevant to anything, but the person thinks of them as somehow part of their life. That's a not uncommon example. Old magazines or newspapers where the information is no longer valid or relevant, but the person doesn't want to let it go just in case there might be something there. It's very hard for spouses. And what we typically do is ask people, the family members, whether it's spouses or adult children, to begin carefully to ask the person about what are the meaning of these objects to them. And then as they begin to work on that and think about what they really want in their lives versus what this particular object represents, there might be some avenue for negotiation. For the most part, I think it's difficult for a spouse to understand all of the issues involved. But if they keep their focus on the quality of life that both of them share and the safety of the home, that will get them further than just urging someone to get rid of something.
Dr. Steketee, I get a catalog, which I might say I recycle quite promptly. However, one of the items in that catalog is a T-shirt. And on the T-shirt is the motto, "It isn't hoarding if it's books." Are there any items? Are there any items that are exempt from hoarding?
I'm afraid not. And books are not one of them, although I've heard that argument used before. We worry about books when they really have taken over space and start to weigh a great deal so that we're concerned about the stability of the furniture they're in or the floors they're sitting on. That's when you know you've really gone too far with it. But I will say that, we do tolerate among each other more books, perhaps, than we might tolerate other items like empty rolls of toilet paper, that little cardboard thing there. People who collect those might be standing on thinner ground.
Well, this really strikes close to home because my dad was a book collector. And in our home, we probably had somewhere between, I'd say, 60 and 80,000 books. So that when we moved my parents from Pennsylvania to North Carolina, we needed 2 tractor-trailer trucks to bring all of his beloved books to the new home. And needless to say, they didn't fit in the new home. We actually had to get a storage area for him. But the bottom line was he fancied himself a book collector, bookseller. He just didn't like to sell books. He just liked to collect them. They were all on shelves. They were all organized. He knew where they all were. And they didn't interfere with his life. I mean, he just loved He loved reading them. He loved touching them. He loved sharing them. He loved selling them on occasion. But I never thought of him exactly as a hoarder. He thought of himself as just a book collector. But maybe he was a hoarder.
But it didn't interfere with his living. So he certainly didn't qualify for hoarding disorder. He was a collector and perhaps a bit on the extreme side of collecting because it sounds like at least there was a very wide variety of topics if he had that many books to fill 2 tractor trailers. The storage of those then starts to become expensive, and it's really, in that case, about what someone can afford. But the bottom line is, does it interfere with your life? And if it didn't.
It didn't interfere with his life, but we've heard of people who actually have to buy another house just to store all their stuff. And that sounds like it is pathology. I'm just wondering, Dr. Steketee, how would somebody who is a hoarder, maybe the entire basement is just cluttered with piles and just junk everywhere, or maybe it's a garage. How does somebody begin to tackle a huge project like cleaning all of that up?
Well, the first question for everybody who has a hoarding problem is, what are your values and your goals in life from this point forward? What do you care most about? And what do you want to accomplish in the long term and in the short term? Often for somebody with a serious hoarding problem, that's about social life, about being able to have my grandchildren over and play in the living room. That's not about garages or attics or basements, because those are storage areas that we use. But if you need to get your car into your garage and you can't, then that's an area of work, because your goal then is to have a good housing for your car in the winter, for example. And your value is that the objects in the garage that are taking up space now are not as important to you as having a car that's protected from the elements. So there you see you're weighing one thing against another. And at that point, you can go into the garage and start picking out the areas of the garage, the physical areas that need to be cleared. Perhaps not the walls, but rather the middle part that's standing in the way of getting the car in, if you see what I mean.
I do. And that actually brings up, it gets us into another area that I think is very important. What kinds of treatments are available for people with hoarding disorder?
The treatments that are best tested at this point are called cognitive and behavioral therapies for hoarding disorder specifically. Now, cognitive and behavioral therapy is used for a wide variety of problems with anxiety, depression, eating conditions, many, many mental health problems. For hoarding, we have to target the specific problem areas that people have. And so the behavioral part of it is the learning of skills so that you can physically organize objects in your home that are otherwise in complete disarray. So you can't find what you need and you have to rebuy it because you can't find it. That's obviously a waste of resources. So practicing skills of organizing, of making decisions about what is and is not important to keep for the future, those are common skills training areas. Other parts of the behavioral are that people need to practice letting go of objects so that they get better and better at making those decisions and at removing items from the home that they've made decisions they don't want. That takes a lot of work because the parting process is painful for people, or they wouldn't have saved them all along. And then the cognitive aspect of it is, what do people believe about their objects? And does that make sense to them? So that's a conversation with a therapist or a clinician who's helping them sort out their beliefs that cause them to keep things that even they don't think are as valuable according to their own values and goals in the world.
I suspect that's challenging, and I'm wondering if you could share a story of how perhaps you or your colleagues have managed to overcome some really difficult hoarding situations, how you were able to help someone overcome their attachments.
Let me put that in context because it is not easily done or quickly done. And it is a back and forth process with any person who has hoarding disorder so that they try to keep in front of them what they're aiming for in their lives while making individual choices about each object they own. That obviously takes a lot of time because they have many, many objects in their environment, and they have to evaluate the importance, the value of those objects in their own lives. So yes, it is a long and time-consuming process, and I could point to any number of clients for whom it takes weeks, months, and sometimes a couple of years to accomplish. But someone who's actively working on it with a clinician who is able to help them, and I should say it's not always just a clinician. Sometimes we have people from community service agencies who are helping them. We've had occupational therapists helping. We've had professional organizers who are helping them, etc. Anyone who can sit with them and help them learn that decision-making process will make a big, big difference in their lives. But what we're clear on is that it takes time, and it will not be a 12-week treatment, for example.
Well, I'm guessing that not all therapists are trained in hoarding disorder. It sounds like it's a little bit aligned with OCD, obsessive compulsive disorder, and I suspect that a lot of people think, well, just give me a pill. I know Prozac might work for OCD. Why can't you just give me a drug that will help me overcome this challenge? How do we help people understand that it's probably not as easy as a pill, and not all therapists are trained in how to actually deal with hoarding disorder?
So that's two questions, I think. You're right. Many clinicians are not trained, but on the other hand, there's been a lot more opportunity to learn about hoarding and about how to treat it. So many of us in the field of research and clinical work have trained a lot of other people to do it. So it's getting easier to find that skill set in the mental health world. It's also a challenge, I think, for clinicians to figure out how best to intervene. So seeing someone once a week is not going to cut it if you need to be working actively on an almost daily basis to go through at least a small pile of objects that need to be sorted. But many people aren't ready to do that until they've actually made the hard decision that they want to go forward, until they feel motivated for it. And so that's another area of work. We call it motivational interviewing or motivational enhancement, to help people decide for themselves when they are really ready to go. There's a lot of pressure from the outside to do it, and that's sometimes a very good thing. But the motivation to do the work has to come internally in order to make it happen.
And the magic pill?
The magic pill doesn't exist. Yes, some of the serotonergic reuptake inhibitors, the drugs like you've mentioned, might be helpful if depression is a problem for a person, but that alone will not help them learn the skills and be able to let go of objects that were once important to them. If a person has attention deficit difficulties, they might benefit from drugs that are helpful for that, to keep their focus on what they're doing. But again, it won't help them with the skills and the actual practice.
Dr. Stegety, we're getting close to the end of our time with you. What are your suggestions for someone who suspects that they might have a problem or As I understand it, denial is pretty common. Someone who suspects that a family member might have a problem.
The best thing a person can do is to read up on this. And here what I'll do is suggest that a resource is the International OCD Foundation website on hoarding. It's IOCDF. And if they go to that website and click on the Hoarding tab, they will get to information about hoarding. That might well lead them to either seek a referral within that group or another mental health group to see if someone is around. There are task forces in many communities that are focused on hoarding, so hoarding task forces or mental health task forces that are familiar with hoarding. That will help trigger the community service providers to assist, especially for older adults. For example, the Department on Aging is often knowledgeable about this. So information is the place to start and then to seek referrals from there.
Dr. Steketee, what things are not helpful? I suspect that family, friends complain bitterly about someone who is, in fact, a hoarder. And so there's this constant nagging, for example, from a partner. Why don't you clean up the garage? Why don't you do something about that basement? It's just full of junk. And the person probably doesn't benefit from that kind of criticism.
You're absolutely right. A chronic complainer who says, yes, you could just throw that out. Why don't you just throw that out? Or who steps in and throws it out for them without their knowing about it. And then they find out later that's often a bit disastrous. Cleanouts are not helpful, where a family decides that an older parent, for example, just needs to be taken away on vacation while some cleaning company comes in and cleans out the house. That is a recipe for family ruination. And the other thing is just language. Don't call someone else's objects junk. That's not how they see it. So there are many unpleasant ways of causing trouble and not promoting therapy-seeking behaviors because the relative is just not understanding about these things.
Well, we're so happy there are things that we can do, and obviously therapy is critical to success.
Dr. Gail Steketee, thank you very much for talking with us on the People's Pharmacy today.
My pleasure.
You've been listening to Dr. Gail Steketee. She's Dean Emerita and Professor Emerita at the Boston University School of Social Work. Her work is focused on the nature of hoarding symptoms, including difficulty discarding, clutter, and excessive acquiring. She's developed and tested cognitive and behavioral treatments for OCD and hoarding. She's the author of several books, including Hoarding, What Everyone Needs to Know, with Christiana Bradiotis.
After the break, we'll talk with Dr. Christiana Bradiotis to find out what it's like to have a hoarding problem.
What can be done for this type of problem? We'll learn about a community harm reduction approach.
How has the pandemic affected people with hoarding disorders?
You're listening to The People's Pharmacy with Joe and Terry Graydon.
This podcast is brought to you in part by Kaya Biotics, organic probiotic supplements. These supplements are made in the USA with high-quality, sustainably sourced ingredients.
Originally developed in Germany, Kaya Biotics offers 3 different formulations with 15 carefully selected strains of bacteria. These are designed to increase the diversity of your gut flora and support your immune system. More information at kayabiotics.com. Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon.
The People's Pharmacy is brought to you in part by CocoVia, maker of high-potency cocoflavanol supplements, that support cognitive and cardiovascular health. More information at cocovia.com.
And by Kaya Biotics, microencapsulated, organic, hypoallergenic probiotic products developed in Germany and made in the U.S. KAYABiotics.com.
Today, we're talking about hoarding. Has the pandemic complicated this situation?
We turn now to Dr. Christiana Bradiotis. She's an associate professor in the School of Social Work at the University of British Columbia and associate director of the UBC Center for Collaborative Research on Hoarding in Vancouver, Canada. Her current research interests center on hoarding treatment in the context of affordable housing and community-based organizations. Professor Bradiotis is the author of several books, including Hoarding, What Everyone Needs to Know.
Welcome to the People's Pharmacy, Dr. Christiana Bradiotis.
Thank you very much. I'm delighted to be with you.
Dr. Bradiotis, we just spoke with Dr. Steketee, your colleague and co-author, and I'm wondering if you could help our listeners better understand what it's like to have a hoarding problem. Maybe you've dealt with someone who really was challenged, and what was that like for them?
Certainly. I'll tell you briefly about a woman that I worked with who lived in the northeastern part of the United States. She was a woman in her early 60s, had been a nurse for her entire career, and her hoarding really began in childhood. She talks about saving and collecting things from visiting Cape Cod, so shells and rocks, and the collections growing from there to the point at which they overtook her even as a child. By the time she moved out and was living independently, her home became unusable. So she couldn't sleep in her bed. She couldn't sit on her couch. She was unable to prepare meals in her kitchen. Though she was a very social person, she was unable to have anyone in her home. She had, unfortunately and tragically, a number of significant losses in her life, and each one of those losses seemed to worsen the hoarding problem. By the time I met her, her home was entirely unpassable. I stood at the threshold and was unable to enter her home. She had very tiny paths, enormous piles that she had to climb over just to get to the door and to get to various areas of the home. And in truth, she had really no quality of life in her home at that point.
My goodness, what can be done for someone like that?
Well, we're very fortunate to be living in this time where, following about 25 years of systematic scientific inquiry, we now have a better understanding of hoarding, better than we ever have before. And that being said, we are also quite a long way from being perfect in our intervention approaches. There's still much to learn. There's things about the nature of the problem that we don't understand, and therefore interventions aren't perfect at this point. But we have available to us a well-refined intervention for individuals and families using cognitive behavioral therapy, of course. And we also have community-based interventions that take a more harm reduction approach. So we really have two different avenues. They're quite different from one another, actually, to help support someone to address their difficulty with saving and discarding objects.
I wonder if you can tell us more, please, about the community-based harm reduction approach.
Sure. Harm reduction is a set of principles borrowed from the field of public health, and listeners may be familiar with the idea of harm reduction as related to substance use, for example. So if someone is using substances intravenously, they may not agree to stop their intravenous drug use, but they may agree to use clean needles each time they use. So that is a harm reduction strategy. It is not aimed at ameliorating the behavior, but instead it's aimed at helping people who want to carry on with the behavior do it more safely. So applied to hoarding, the focus here is not on clinical treatment or on a full course of cognitive behavioral therapy. Instead, the focus is on helping people move items out of high-risk areas of their home so that they can live more healthfully and safely while likely continuing some amount of hoarding. So a small example of a harm reduction strategy might be to help move papers that are currently stored on the stovetop or in the oven to a place away from the heat source.
Wait a minute. Did you say in the oven?
Yes, in many hoarded homes, objects are stored in unsafe places just because of the sheer quantity of objects.
Wow, that seems pretty desperate when people are putting paper in the oven.
Well, and you can imagine that it leads to significant risk, not only for the inhabitant of that home, but if there are shared wall neighbors, for example, in places like apartment buildings, there is then the risk for fire, not only for the inhabitants who might be doing the hoarding and their family members, but for shared wall neighbors as well.
Absolutely. So how do you go about convincing someone that the papers need to come out of the oven and off the stovetop? I'm assuming if you've got papers in your oven or on your stovetop, you're not cooking, and you might not be even really eating much.
That's right. And you're really pointing to the fact that the quality of life for many people with lived experience of hoarding is compromised because of their hoarding behavior. And so one of the useful strategies I think people can take, whether they're family members or neighbors or concerned friends or a professional trying to work with a service user or client, is to actually ask the person what it is that they value in life and how does their hoarding behavior interfere with their ability to live out that value. So, for example, going back to the stovetop and oven being full of papers, if someone values eating nutritious meals or being able to prepare meals for their family or friends, having so much stuff in their home that prevents people from coming over or being able to use the stovetop or oven to prepare those meals is inconsistent with their values. And from there, we can begin to build some intrinsic motivation, perhaps to consider addressing the hoarding problem.
Dr. Bradiotis, I'm curious, how did you get interested in hoarding disorder? This is not the typical therapist approach. What got you intrigued?
Well, I had the very good fortune to be a doctoral student at Boston University, where Gail Steketee was carrying out her research on hoarding, along with her colleague, Dr. Randy Frost, who was at Smith College at the time. And Gail offered me the opportunity to work on the first study funded by the National Institute of Mental Health, exploring interventions, clinical interventions for hoarding. And I sat down with my first patient. At the time, I was clinically trained. And so Gail hired me as a study therapist. And I sat down with the first patient that I ever worked with hoarding, and I was captivated by the clinical problem. It is complex, and hoarding disorder in its most extreme forms often occurs alongside other mental health problems that further complicate interventions. And I have to say, it's a bit of a metaphorical problem as well. I think as people begin to clear away the clutter, what they uncover is what is driving the acquiring and saving of objects, whether that's life losses or other physical or mental health problems, and they begin to see the interference of those pieces. So it's a very complicated problem. And I believe that the people who have hoarding behavior and make a choice to address it are some of the most courageous people I know. It's very difficult emotional and physical work, and it's an honor to work alongside them.
Dr. Bradiotis, I am wondering how the pandemic has affected the individuals you've been working with.
It's interesting. We hear from people sort of two different stories as related to the pandemic. One is that many people were spending more time at home than they typically would otherwise if they had the ability to be out in the world more freely without risk. And so that being at home led to increased attention and focus on the accumulated objects in their home. And they decided that perhaps it was time while they were at home to put some effort in that direction. And so some people found it very helpful to be at home more and have been able to make progress on their hoarding. Other people found being at home quite distressing. That is, that they find being in their clutter and having to focus their attention on it without an escape outside of their home quite distressing. And we've seen an exacerbation of some of the co-occurring symptoms like major depression, major depressive symptoms, or anxious symptoms that often occur alongside hoarding.
I think one of the examples that people can relate to as a community problem is animal hoarding. I wonder if you could address that briefly.
Sure. Animal hoarding, we know, is certainly related to the hoarding of objects, but has very distinct features. Along with my colleague, Dr. Catherine Ayers at the University of California, San Diego, we have done a bit of work in this area. We find it quite challenging, actually, to get research subjects or participants for research on animal hoarding, which is why our knowledge in this area is still so limited by comparison to our knowledge of object hoarding. Certainly, animal hoarding cases come to the attention of media. We hear on the evening news or read in the paper of a person having 40 dogs or 60 cats. And one of the grave risks that exists with hoarding animals, of course, is the harm that may come to the sentient beings, both the animals and the humans. And we know that the conditions where there are large quantities of animals in a home are often quite deplorable. That is, that there might be high ammonia levels because of the urine from the animals or an accumulation of feces. So these create extra special challenges for communities. Humane societies, SPCA, and animal welfare organizations, along with the veterinary community, have really taken the lead in helping the psychiatric and psychological community learn how to address this problem.
One of the questions that I have has to do with what I would call recovery. And I'm guessing that you've had patients who have completely recovered from their hoarding problem, but how do they keep from repeating the process? Because I know I clear off my desk periodically and I go, oh, isn't that great? And then 6 months later, the clutter is back.
Sure. You point to one of the significant challenges in addressing the behavioral manifestation of the problem of hoarding. And we know that people do recover from this problem. They are in recovery, and relapses and lapses happen. And so one of the very important things that I often point to as I'm helping people come to the end of treatment or their community intervention and think about maintaining their gains is to have adequate social support, especially in the home. And so you might think about your own life and listeners as well. I know that when I know that I have friends coming over for an afternoon tea, I'm going to tidy up just a bit more than if no one is coming over on that day. Though I am not a person with a hoarding problem, the same principle really applies, which is that one of the ways to prevent relapse is to make sure that people feel supported, not only socially, but to have the skills and reminders of the skills that they've learned in order to implement them to maintain those gains.
Dr. Bradiotis, what are the most important things for all of us to remember or recognize about hoarding disorder?
The first thing that I would say is that it's very easy to judge hoarding behavior and people with lived experience of hoarding based on the manifestation or the way in which we can see the problem. So the amassed amount of clutter in the home and the saving and acquiring that people do. And when we see especially the clutter in the home and the conditions, it's very easy to judge that as a moral issue, as being about perhaps laziness or lack of cleanliness or standards. And I think it's most important to recognize that people with lived experience of hoarding are struggling against a mental illness that is robbing them at the present moment of living their best and most healthful life. The second thing that I would say is the use of language is very important. And hopefully you've observed that I have used people first language, which is a convention used, not everyone's preference, but referring to the person before their behavior. So a person who hoards or a person with lived experience of hoarding, rather than using the term hoarder, which many people find a derogatory term. I also try in my own work not to use terms like garbage or trash or rubbish when referring to people's possessions. In fact, the things that mean oftentimes the most to them, calling them things or stuff or objects or even treasures. So that is mirroring their language. And then finally, and quickly, the third thing that I would say is that motivation to make a change in regard to the amount of objects saved and those accumulating in the home is really an issue of building internal motivation. External sanctions only go so far. So really taking a supportive posture, keeping the person at the center of the intervention and supporting them to make the changes on their timeline is really what's most important.
Dr. Christiana Bratiotis, thank you very much for talking with us on the People's Pharmacy today.
Thank you.
You've been listening to Dr. Christiana Bratiotis. She's an associate professor in the School of Social Work at the University of British Columbia and associate director at the UBC Centre for Collaborative Research on Hoarding in Vancouver, Canada. She pioneered work in the formation and operation of multidisciplinary community hoarding task forces and is the leading global authority on implementing community-based interventions for hoarding. Professor Bratiotis is the author of several books, including Hoarding, What Everyone Needs to Know, with Dr. Gail Steketee.
Lynn Siegel produced today's show. Al Wodarski engineered. Dave Graydon edits our interviews. B.J. Liederman composed our theme music.
This show is a co-production of North Carolina Public Radio, WUNC, with the People's Pharmacy.
The People's Pharmacy is brought to you in part by Kaya Biotics, organic probiotic products developed in Germany and made in the U.S. KAYABiotics.com.
Today's show is number 1286. You can find it online at peoplespharmacy.com. You can subscribe to our podcast through your favorite podcast provider. We post the show on our website on Monday morning.
If you'd like to add a comment about the show, look for the post on our website. You can enter your comment at the bottom of the show notes for number 1286 under the podcast tab.
At peoplespharmacy.com, you can sign up for our free online newsletter to get the latest news about COVID-19 and other important health stories. By subscribing to our newsletter, you'll also have regular access to our weekly podcast and find out ahead of time which topics we'll be covering.
In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you for listening. Please join us again next week. Thank you for listening to the People's Pharmacy Podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money.
If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in.
All you have to do is go to peoplespharmacy.com/donate.
Whether it's just one time or a monthly donation, you can be part of the team that makes this show possible. Thank you for your continued loyalty and support. We couldn't make our show without you.